Okay, now the moment y'all all been waiting for. Your ABGs, okay? Arterial blood gases, okay? This can be tricky, okay? This can be tricky, but we're going to get it down, okay? You're gonna get it down. So we first and foremost need to address where your gas exchange occurs in your alveoli, okay? Those little grape-like sacs. That is where your gas exchange occurs, okay? You inhale oxygen, okay? The oxygen is then transformed into your blood, okay? And then you exhale the carbon dioxide. So the deoxygenated blood gives off the carbon dioxide and puts it into the alveoli so that you can exhale, okay? And so when we draw ABGs, arterial blood gases, it's going to give us a good picture of what's going on in the blood, okay, as it pertains to the gases, okay? So for respiratory wise, ABGs are used to assess oxygenation, okay? Assess and address the needs, okay? The needs for the patient in regards to oxygenation and chest tube placement, okay? So first and foremost, your normal ranges, okay? You need to know your normal ranges of ABGs because if you get a panel of ABGs back, how are you gonna read them, all right? So your ABG normal ranges for your pH, okay? pH, your normal ranges is from 7.35 to 7.45, okay? Anything below 7.35 is acidic, okay? Anything above 7.45 is alkalytic, okay? Now you have a PaCO2 level. This is that carbon dioxide. This is going to tell you if there's a respiratory problem or not, okay? 35 to 45 is the normal range. If you have anything more than 45, it is then acidic, okay? Too much carbon dioxide in the body is toxic, okay? And it is acidic to the body, okay? If your PaCO2 level is less than 35, then it is alkalytic, okay? Now, you have an HCO3 level. This is your sodium bicarbonate level, okay? This is your metabolic, okay? Your metabolic level. This is what you want to look at to determine if it is a metabolic issue, okay? Your books say that the normal level is 22 to 26, okay? Anything greater than 26 is alkalytic. Anything less than 22 is acidic, okay? Then you also have a PaO2 level, which is your blood oxygen level. The normal ranges is from 80 to 100, okay? And if you're watching this, or if you're taking notes, I need you to note that the whole goal for the body, okay, is homeostasis, okay? Your systems and stuff work hand in hand and work together to maintain homeostasis for the body, okay? I also need you to note down that compensation equals help, okay? Compensation equals help, okay? Note that down. So now, if you have a normal pH, okay, that means that the body is compensating and trying to help fix the problem, okay? If you have an abnormal pH, then that means there is uncompensation, okay? The body is not working hard enough or working adequately enough to restore the body's homeostasis, okay? So I'll start there, leave that there, okay? Leave that there. So back to respiratory and applying your arterial blood gases, applying to them to your nursing process. Your cues and things that you want to look for, because we are talking about respiratory disorders. Your respiratory rate, okay? You want to look at that. Your dyspnea, they're going to be struggling to breathe. Retractions, okay? That breathing retraction, the protruding rib cage and the diaphragm being sucked in, okay, or retracting inward. Tracheal alignment, okay? If there's any deviations, your breath sounds, and your hemodynamic status. You want to assess all of that, okay? You also want to then analyze, okay, expected findings. That PaCO2 is most likely going to be elevated. Elevated meaning above that 45, okay, which puts us in an acidic range. Okay, they will have decreased O2 saturations. That's your pulse ox. Okay, so don't misconstrue SaO2 and PaO2. Okay, SaO2 is your oxygen saturation. Sa, saturation, that's the pulse ox you put on your finger. PaO2 is the blood oxygen level. Okay, you may find some asymmetrical chest expansion depending you're dealing with a pneumothorax or however. Okay, breath sounds will most likely be diminished or may even be absent. Okay, unexpected findings. They may be severely hypoxemic. Okay, severely hypoxemic, that's that blood oxygen level, okay, being way below 80. Okay, cardiopulmonary compromise and failure. Okay, again, your heart and your lungs, they're locked in. They work very, very close together. So if one's failing, the other one is bound to fail. Okay. You will can also lead your patients. Unexpected findings will lead into respiratory failure, in which I will create a separate video. Cardiac arrest as well. Okay. You want to prioritize your hypothesis to look forward, assess, monitor your ABCs, address any pain. Okay. Try to foresee like what this could be. Okay, or what is going on with my patient. Assist with chest tube placement for your patients. Ensure informed consent is obtained for that chest tube placement. Make sure the environment is sterile and that the patient is in the correct position. Okay, you want to make sure to try to, when generating your solutions, decrease the absence of pain, normal effective respiratory patterns, and educate your patients. Okay, as far as your implementation and your interventions go, continuously monitor the respiratory status. Maintain chest tube function. Okay. Then you want to evaluate, is the situation improving? Is it deteriorating? Is it staying the same? Okay. So now, back to our actual readings and our actual numbers. Okay. I'm going to give you a practice problem. Okay. So you have a patient who is experiencing some dyspnea, some difficulty breathing from scuba diving. Okay, they were scuba diving, low depths, okay, that pressure, all right, and they arrive to you with the vital signs as 98.9 for the temp, 112 for the heart rate, 36 for the respirations, 84 over 40 for their blood pressure, 76% for their O2 sats or their SaO2 on room air, 76. Okay, yes, their vital signs is horrid. Okay, their ABGs read a PaO2 of 44. Okay, a PaO2 of 44. We know our normal ranges for PaO2 is 80 to 100, and they're at a 44. Okay, a pH of 7.31. Again, our normal ranges is 7.35 to 7.45, but this patient is at a 7.31 for their pH. Their PaCO2 is 50. Okay, 50. So we know our normal range is 35 to 45, so it's exceeding. Okay, our HCO3 for this patient is 32. Okay, which is also abnormal. So looking at that, okay, your PaO2 is at 44. So it's obviously decreased, okay? They are not getting an adequate amount of oxygen in their blood. They don't have an adequate amount of oxygen in their blood. Their normal blood oxygen level should be 80 to 100 and they're at 44, okay? There is a problem here, okay? Their pH is 7.31. The normal ranges is 7.35 to 45, and we know anything less than 7.35 is acidic. Okay, so by just looking at the pH, because that's what we want to look for, we know this is a difficulty breathing The patient presented to us with difficulty breathing. We know they're struggling respiratory wise. Their vital signs even stated so as well. So we look at the pH next, and it's 7.31. That tells us that our patient is in alkalosis. Our patient is in acidosis, okay? 7.31 signifies acidosis because it's less than 7.35, okay? Our PaCO2 is 50, okay? Our normal range again is 35 to 45. If we have too much carbon dioxide in our body, it's toxic to the body. So that also tells us this is a respiratory acidosis problem. So now our HCO3 is 32, okay? We said our normal range was 22 to 28, right? 22 to 28. Anything greater than 28 is alkalytic. Anything less than 22 is acidic. But guess what? Okay, that HCO3, like I stated, your body's goal is homeostasis, right? That HCO3 now went more alkaline. It's going more alkaline to try to pull back that carbon dioxide to a normal level, okay? It's trying to compensate, but it's not compensating enough, okay? So this would be uncompensated respiratory acidosis, okay? And what I mean by not compensating enough is because our pH is still abnormal. As long as our pH is abnormal, it's uncompensated, okay? The bicarb level, that HCO3, it could be trying and trying and trying all it can. But as long as our pH is abnormal, it will still remain uncompensated. It's like that. You're not doing enough, okay? I gave the analogy before of thinking about it as tug of war, okay? Think about it as tug of war. I wish I had something here to kind of, let me see if I can use this. Use my earphones. Tug of war. So we're gonna say this is the homeostasis, okay? This piece in the middle. So we have our CO2 level here, we have our HCO3 level here, and they're pulling, okay? They're pulling at just the right amount to keep our ABGs in line, okay? But say we have a respiratory problem, all right? A respiratory problem like this one, that's the CO2 is pulling in the acidic range, okay? Pulling. This bicarb is gonna pull more in the alkalytic range as hard as it can to try to get this back in the middle, okay? It's going to compensate. It's going to try to help. But the question is it compensating enough, okay? Is it compensating enough to bring that pH to that normal level or not? Okay, and the pH is going to tell us. The pH is tell all. Is it alkalosis, is it acidic or acidosis? Is it compensated or uncompensated? Your pH is the tell all, okay? I hope this helps, all right? For this patient, it's like, what actions do you take? Assisting with normalizing the ABGs. These are things that you should be thinking about as the nurse. Okay, what should you as the nurse, include in the documentation of the chest tube? Okay, so the actions that you should be taking to assist with normalizing this client's ABGs, oxygenation, okay, preparing them for a chest tube, okay, frequent vital signs, all right, those things, the things that we went over, right? Excuse me. You want to continue monitoring their respiratory status, continue maintaining the chest tube functions, okay? You need to do all of that. You also change the client positioning, sit them upright, okay? What should you note or what should you document in regards to the chest tube? Are there any bubbles, okay, in that chamber? Is there any leaks going on? What's draining out? What does it look like? How much is coming out? Everything, okay? You need to document everything. One key thing that I want you guys to remember and not forget, if it is a respiratory problem, again, respiratory CO2, okay? We exhale carbon dioxide. That should be the easiest way to remember that, okay? The reason we exhale carbon dioxide is because we can't keep too much in the body. It becomes toxic, all right? But that CO2 level determines if it's a respiratory problem, Okay, that HCO3 level, that's that bicarb, that tells us it's a metabolic problem. It's something happening in the body. Okay, a lot of the times, look at your symptoms, your signs and symptoms, your cues. Okay, that's gonna tell you what the problem. That's gonna give you like that's gonna help you to foresee the problem at hand. So in this situation or scenario that I gave you guys, they already told you they had difficulty breathing. They were scuba diving and all of that, and then your vital signs even told you how they were struggling. The O2 sats were 76. Okay, so we know even just before even looking at the ABGs that was a respiratory issue, right? Now, if it's a metabolic problem, something happening in the body, they may have diarrhea. Okay, they may have a acute kidney injury. Okay, something going on in the body. Okay, that will tell you those manifestations. That will tell you that it's a metabolic problem. Okay. I hope this helped with your ABGs. If not, you know how to reach me. All right. Happy studying.